All yours. We're in your town, so go ahead.
Now we're talking. Quote him. Welcome. Before we officially welcome the governor, I just want to acknowledge some of our elected officials who took the time to be here today. First off, my partner in crime, so to speak, the DA from neighboring Lackawanna County is Brian Gallagher. And the DA from Luzerne County would be here today, except he is in Florida with his wife on her birthday. So
Smart man.
she trumps this, I guess. And our county commissioners who work together almost seamlessly, which is a wonderful thing in county government. Ernie King, Tom Henry, and Rick Wilbur is the chairman.
Thanks, guys.
Our mayor of Tunkhannock, Stacy Huber, also a veteran. So thank you for that, Stacy. And with that, I get the privilege of welcoming a friend, actually, from before he was Attorney General, much less governor.
That's right.
And then a colleague when he was the state's chief law enforcement officer as AG. We worked together on many, many issues. Now as my governor and our governor, Josh Shapiro. I am delighted that he chose this county along with the cabinet secretaries who we are honored to host as well as this panel and all of you, to talk about success. Because when we deal in this arena, particularly of opioids, and now the dastardly fentanyl, which as a street cop where I started and a police chief and the state's chief drug prosecutor for every AG except this one, ironically, and as a federal mafia prosecutor where organized crime had its hand in drugs, and then in two White Houses, Clinton and Bush, as a deputy drug czar, I have never seen a problem so insidious as the opioid problem, which has now, when you think it can't get worse, morphed into fentanyl, which is a killer. So to see what the governor has done in terms of arraying state government to be a help rather than an impediment, and being aggressive about distributing things like naloxone, that allows us at the county level to take that lead and to be innovative. And I stand here and I dare say it, but out of the work of so many people in this room and our coalition of coalitions, we're probably the only county that has organized. I've got every community service organization, the school district, every business group meeting every month. And the thing we do, in addition to teen suicide and other projects, is focus on Narcan distribution and Deterra, which is a drug destruction pouch, the antithesis of saying, bring your drugs here and we'll destroy them. We're going to send it to you, senior citizen, and we're the third most senior place in addition to being rural. So let's send them that Deterra and let them destroy their own drugs and be part of the solution. So with all of that and this partnership from state to county to local, it's my privilege, and it really is, to introduce my friend and our governor, Josh Shapiro.
Thank you. Thank you, Joe. Thank you. I really appreciate the comments of your district attorney, and I want to speak to them in a moment. I just want to lay out what I hope we can accomplish here today. I want to offer a few brief comments. Together, I'm here with Secretary Bogan and Secretary Davis-Jones, who lead this work in our administration. And then we really want to open up and have a conversation with all of you around this table and hear what is on your mind, talk about the progress we've made, but also talk about the work ahead. And I really want this to just be a free-flowing dialogue. Let me set the table and pick up where my friend Joe Peters left off. He has an extraordinary record in law enforcement. You heard him speak about that, his work at the federal level, at the state level, and here as Wyoming County District Attorney at the local level. He believes in the power of collaboration, and we both understand that you can't arrest your way out of this crisis. Notwithstanding his extraordinary legal background and his work combating, criminal mischief in our communities, he understands you've got to have an all-of-the-above approach where everyone comes and works together. It's got to be multidisciplinary. And so I want to just commend your DA for understanding that and for implementing it and using the power of his office, not just to make an arrest, of which I know you make many, but setting the table for real collaboration. We are sort of unlikely, buddies in this political environment that we all find ourselves in, where things can always seem, just too darn divisive. And we have shown an ability over many, many, many years to work together. And I think that's what the good people of Pennsylvania deserve, and that's what we've tried to model. And so I appreciate your leadership very, very much. And I will tell you that this is not my first time here in Wyoming County. It's not my first time in this building. I wanted to be back here today. I think I was here the first time in 2018, then again in maybe 2022 or so, 2021, 2022. I want to talk about the progress that we've made, and I want to be really, sober-eyed about the future challenges that we face. You heard me speak a moment ago relative to Joe and his leadership about the importance of collaboration and the importance of a multidisciplinary approach here. That's the approach I took as Attorney General of this Commonwealth. Serving for 6 years, we arrested over 8,000 mid and high-level drug dealers across our Commonwealth. We launched LETI, the Law Enforcement Treatment Initiative, which I'm proud is now up to 34 counties, where someone who is in need can walk into a facility like this, can walk into a police department, can walk into a county office and not fear the risk of arrest, but rather raise their hand and say, I need help. And now you've got wonderful county leaders and others trained to get them the help that they need. If someone has the courage and the strength to ask for help, we need to meet them more than halfway, and LETI is doing that. In addition to that, we understand that while an arrest may be made at the street corner, the real problem started by greedy executives in pharmaceutical company boardrooms many, many years ago, when they lied to the people of Pennsylvania. They lied to the American people about the addictive nature of things like OxyContin and these other pills that oftentimes lead people down a road of addiction. And so I took on, as your Attorney General, those CEOs. I took on those corporations and brought over $2 billion back to the Commonwealth of Pennsylvania and earmarked it for treatment and related services. Importantly, when we divvied up those dollars, we made sure that 15% of those dollars, 15% of that $2 billion, went to Secretary Davis Jones's office, the Department of Drug and Alcohol Policy. But 85%, the lion's share, were driven out to the counties, because we understand at a local level, and you heard the DA talk about this, you all have your act together. You know what is needed. And so we wanted those dollars to flow to your counties. And I'd be remiss if I didn't also acknowledge the DA of Lackawanna County, the fact that here in northeastern Pennsylvania, you really have a great system where you all work together even across county lines, and I appreciate that. So that's the approach that we took. Hold the greedy corporate executives accountable, make sure law enforcement is there to make an arrest and to have an open hand to help people get the support they need. Back when we were doing this work together, when I was Attorney General, we were losing 14 and a half, almost 15 Pennsylvanians every single day. And I must tell you that it was, for me, not only a tragedy in the loss of life, it was emotionally gut-wrenching to listen to the moms especially talk about their children's battle with addiction, talk about how it started maybe with a sports injury, taking their kid to the doctor, learning that their kid needed a surgery and then given a few pills to help them get through the aftermath of the surgery. And next thing you know, that child was addicted, and this parent is walking around not only with a child who's battling, but also the guilt that a parent feels by putting their child in that position. I say that not just as your governor, but as a father of 4 children. That is emotionally gut-wrenching. And those moms hung with me, and their plight hung with me, and that's why we worked so hard in a collaborative way to do this work. 15 Pennsylvanians a day around the year 2020. I came back here today in part to acknowledge that we, and the we is not just my administration, the we is all of us, we have made extraordinary progress. Today in Pennsylvania, we're not losing 15 of our neighbors anymore. We're losing 6 of our neighbors every single day. And while that is cause to acknowledge the good work that we are all doing together and celebrate that, no one should leave here feeling as though the job is done, because we're still losing 6 Pennsylvanians every single day, which is 6 too many. So I think what we're doing is working, but we've got a lot more work to do. And so I came back today to try and best understand what it is that the community needs from us, how we can be of more assistance. Under Secretary Davis Jones's leadership, and you heard the DA talk about this, we've driven out a significant amount of dollars for Narcan. We've driven out a significant amount of dollars to support overdose prevention, $40 million to be able to help increase the number of professionals we have providing counseling and related services by paying off their student debt to enable them to get into the profession they love the most. And I think we've got 2 here just in Wyoming County who benefited from that. So the investments we're making are working, but we also need to hear from you what else we need to do and how we need to continue to drive this issue forward. So we're back here today to continue the conversation. I want to thank this community for your great leadership, for being a model for the rest of the Commonwealth on how to do it, and we're looking forward to hearing from you. So with that, what I'd like to do is just go around the table. Everybody can briefly introduce themselves, and then we should have a conversation. I'm going to ask the secretaries to dive in and engage on this, and ask everybody around the table to give us your thoughts as well. So with that, go to my old friend Ashley here. We've been at this together for a while. I'd love for you to start us off. Tell us who you are. Tell us what brings you to the table here, and then we'll go around to Michael next, and so on and so forth.
All right. So my name is Ashley Bunnell. I'm the clinical director of Endless Mountain Extended Care, so I work in treatment inpatient men's residential facility. However, struggled with addiction myself for years and have been in recovery for 13. This affects my personal life, my professional life, all of the above. And you've done amazing work in this state and helped in this county. And I enjoyed doing the LETI program, which I've seen affect many individuals in a positive manner. So.
Good.
Thanks for the invite.
And when I say my old friend, I mean for many years. I should have corrected the record there.
Oh,
yes.
I'm not that old, but.
No, you are not. You are not. As I said it, I'm like, there's a more artful way to say that.
Thank you.
Thanks, Ash. Great to see you.
Great to see you.
It's working okay. Yeah. So I'm Michael Arty. I am the current Drug and Alcohol Program Administrator, covers Luzerne and Wyoming counties. I served as the Deputy Director since January 2021 and became the head honcho here in this past summer. I come from a mental health background, which I started in 2007. I did that for 12 years. I've really embraced the system we've set up here in the 2 counties to support our clients, the individuals in need. Ashley's place is a great resource for our people, but I can't speak enough to just, from the CEOs all the way to the bottom to the peer support staff. It's been an amazing experience, and I'm glad to be a part of it.
Great. Thank you. Madam Secretary.
Good morning. I'm thrilled to be here. I'm Dr. Deborah Vogan. I'm the Secretary of Health. I'm a pediatrician by training and experience. Came as a secretary with about 3 decades of pediatric experience, and my clinical experience is very relevant to this conversation in that I cared for infants and families impacted by substance use, particularly infants withdrawing from opioid exposure in pregnancy. So I'm happy to bring that clinical expertise as well as the secretary expertise, I hope, to this conversation. So thank you for having me.
Thank you.
Good afternoon, everyone. I'm Dr. Davis Jones, Secretary for Pennsylvania's Department of Drug and Alcohol Programs. I must say that this has really been my life's work. For the past 30 years, I have been focused on all things substance use. I've done all the jobs, right? Prevention, intervention, treatment, recovery supports. It's been a part of how I identify my personal life's mission, but also professional. And so when the governor asked me to come join him, I was thrilled because there was synergy, alignment, and so I'm excited to be here today to have this conversation. So thank you.
Thank you. Amanda?
My name is Amanda Moyer, and I'm a nurse in the Community Health Center here. I am also a 4th-generation Wyoming County resident who unfortunately has had the experience of losing 2 family members in the opioid crisis. I also have the great privilege, though, to work alongside the community stakeholders here. I'm co-chair of our Child Death Review team. I'm on our Wyoming County Action Group, I think we're deciding it should be called because there's so much action involved. I have the great privilege of serving on our Opioid Settlement Trust Fund Committee. I work alongside these folks on Safe Kids NEPA. The list goes on, but it's the same people in this community that work really hard, are passionate about what they do, and really invest in the health and safety of rural Pennsylvania. So thank you for inviting me.
Thank you. By the way, I'll just say, I'm sorry, Robert, before we get to you, my father is a retired, I think he's now been retired for a week or 15 days, pediatrician, and he sat on the Child Death Review team in Montgomery County. And I must tell you, I got a glimpse of that work, which no one should have to see that work, but thank God there are people like you that do that work and end up saving children's lives out of really awful situations. So I just want to say thank you for your work on that and many other things, but they really hit home with me.
Can I thank also Bob Carpenter, who's the co-chair?
Great.
Thank you.
Thank you. You and Bob. Thank you. Bob?
My name is Bob Carpenter. I'm the Executive Director at EMS of Northeastern Pennsylvania, which is the regional EMS council for the 7 counties in the northeast corner of the state. I truly believe that a true save is prevention of illness and injury in the first place. So I make that my work not only in the office, but also in the real world itself. I am practicing paramedic, and like Amanda said, I co-chair the Child Death Review team for Susquehanna and Wyoming County. And because of what we see in that, we created Safe Kids Partnership here in northeastern Pennsylvania as well. So
Great.
Thank you for having me.
Thanks.
Hi, I'm Cammie Anderson. I'm Drug and Alcohol Prevention Education Supervisor with Children's Service Center, Robinson Counseling Center. We are an outpatient drug and alcohol mental health provider for both children and adults. But I am contracted with the Tunkhannock Area School District, so I do the prevention ed for Tunkhannock area for the last 34 years, and I loved every minute of it and still do. I sit on all the committees with Amanda that she mentioned, as well as I'm on a board for our community drop-in center. We just started a drop-in center for our kids in this county to go someplace after school. So I am so excited to be here. Thank you so much.
Thank you. Do you know one of your famous graduates is my press secretary now, Sam?
I do. I was so excited when I saw her on the call yesterday. I was like, and then we were texting.
That's great. By the way, my wife, Lori, our first lady, was at the Tunkhannock Area School District not too long ago. She was so excited when she came back from there. She's like, they do everything there.
It
They're
is
amazing.
a great place. You have no idea. It is truly an amazing, and I'm not just saying that because the superintendent's in the room.
Yeah.
It truly is. It is an amazing place to be, and it really is because of the teachers like Katie and all of those. That's why it's
we
an
honored.
amazing place.
Yep.
Yes.
And Lori is the superstar of that couple.
Oh, yeah.
I want you
Yes.
to know. And
Absolutely.
I forgot
Married
to ask-
way up.
I
Yeah.
forgot to ask about Max and Sophia and Jonah, and who am I forgetting?
Ruben.
Give them my best.
Thank you. I will. We are blessed. All right, so let's get into this. And the beginning of these are always a little bit awkward. I want to encourage you to just have a conversation with us and challenge us. And also, it's okay to tell us something's working and not working. I think for us, we see ourselves in a place where the numbers are looking a lot better. We have dollars now available. We think we're driving them out really effectively. I am certain that our government works a hell of a lot faster than it did 3 years ago, but I'm certain we could still go faster and we could be even more efficient. So I sort of want to start there. How is it working, connecting the dots between the dollars and the effort we have at the state level, primarily under Secretary Davis Jones's office, and what's happening on the ground? Where are you seeing that relationship really strong, and where are you seeing that relationship where it could be stronger? So let's start there, and there are no right or wrong answers, but it's going to help us do our jobs better if you're upfront with us. Cammie seems like she wants to jump in. All right,
I'm the shy one. I'm just going to speak to prevention because I am just so passionate about prevention and feel that it is so important. Not that any of the treatment work that's being done isn't amazing too, but my goal is always to kind of have less people coming through your doors. So I just think one of the things that makes my program work isn't definitely not me. It is the fact that I am in that district 5 days a week. Those kids can find me anywhere. I see those kids in kindergarten, I start with, classrooms on medicine safety. I go all the way up to their graduation. So those kids know me, and then everything in between. And I think that's kind of when I talk about Tunkhannock, what makes Tunkhannock special is we're at everything. Teachers and myself, we're at football games, we're at plays, we're at everything. So I think kids don't really care what you know until they know that you truly care about them. They can't know that if we have somebody that comes in doing prevention once in a while and then leaving. I think funding needs to be so that all counties, all school districts could have a drug and alcohol person sitting in that school. I just think that's what works. It's certainly not me. Anybody could be in Wyoming County, Tunkhannock, doing what I do, and it would work great. It's because I have the opportunity to be here every day.
Let me ask you a question. So part of what I've been really purposeful about is getting dollars into school districts to hire mental health counselors. We've put $300 million in so far. Over 900 school districts have hired mental health professionals. That is working. Is that different from what you are suggesting we need, and if so, how?
Yeah, well, so my funding is just different. So we're like drug and alcohol prevention. There are mental health people that I work very closely with. So this is truly just doing like education. I also do intervention. I work with kids who violate the policy. But I also do a lot of, probably the most important work and the stuff that I love the most is I work with kids whose families have struggled, who may have someone who struggled or lost somebody to addiction. It looks much different to have somebody come back from recovery and be mom and dad again, or to watch your parent die or find your parent dead and never have that opportunity. I grew up in a house of chaos, as I always say to my kids on my caseload, like, yeah, we grew up in chaos. I am blessed today to be the person I needed in high school. So that is, I'm not in mental health. Please don't get me wrong. Mental health is vital to our schools. Yeah. But I think there's a lot of kids out there that struggle too. I have so many kids on my caseload from first grade on up that have a parent either incarcerated or have lost a parent or a parent in active addiction being raised by kin. So I think that's where it's different.
So this is in addition to the mental health counselors. And is this someone who's at the school, and 5 days a week?
Yep, that is my position, and I have a staff of 6, and they are in most, 6 Luzerne County schools. I'm in the Wyoming County, one Wyoming County school. The other thing that also, and I'd be remiss to say, it's also the support of an agency and a school district that accepts you. I have a district that pretty much lets me do whatever I want legally, and right, calls a little, no, but seriously.
Thank you for saying legally in the presence of the DA. Yeah,
they let me. They trust my judgment. I mean, I obviously run stuff by our board, but they do. They really are supportive. What?
Yeah.
Okay.
I'm not sure I have a choice.
Yeah, no, they are extremely supportive of me. So,
and I will just echo what you said. We've heard the very same thing out on our stakeholder engagement tour, the importance of having prevention in schools and making sure that there's enough prevention funding available so every school and every district can have this key resource. We know that it looks different across geographical locations. We also heard that there's the importance of having prevention embedded in schools, but also at the community-based level as well, that they go hand in hand. And so how do we ensure that we have enough funding for schools to do just that, along with other community-based organizations? So spot on. Young people need to see you around the clock, not one and done, those one-off workshops.
And I'm just going to add one more thing, and then I'll stop. I'll let somebody else talk. Part of my job also is that community outreach, which is so vital, because if I'm telling kids one thing, they need to hear the same thing from their parents and from their coaches and from their church leaders. So I think it is extremely important that that is like a 3-prong approach.
Okay. I would just offer a commercial on behalf of the Pennsylvania Commission on Crime and Delinquency, which I think the DA served on in a prior life. We have hundreds of millions of dollars that we've driven out to community organizations, church groups, rec centers, et cetera, that do some of this work to keep kids safe. So I want to make sure your county commissioners, others are applying for those dollars, and Drew can work with you separately on that to make sure that we're connecting the dots for you. Everybody knows Drew.
Thank you.
What else?
I want to touch on the staffing of that, because we talked about the staffing, and the student loan repayment program that you're doing is something that is extremely beneficial, because the people who work in substance use disorder are often underpaid, right? So with the underpaying, going on to school for their master's in rehabilitation, like myself, I put myself in $100,000 of student loan debt. So that program was a game changer for individuals, because often the turnover rate for substance use disorder, and working as the professional in there, the turnover rate is so much because the reimbursement doesn't meet up, and then individuals aren't paid to put somebody in the school 5 days a week. You know, it's difficult. So that is something that's working.
Good.
That I wanted to talk about.
Good. And those two counselors who kind of went through the process here in Wyoming County, they're good, they're happy, like it worked out for them? Do you happen to know them? Or?
So I'm one of them, I think.
I didn't want to,
Yeah. So I'm one of them, and it worked out for me, because the other thing with that is you have to sign with a drug and alcohol facility for 5 years post, which encourages even more development. And my boss got one too, who owns the facility. And I know that 10 other people applied, and I'm just so grateful to have gotten that. But I know it makes a big difference, because I have counselors who are hired who have a bachelor's who won't go on for their master's because they can't afford the debt. You know, so the debt is a big offset. Like, they don't want to do that. And then they stay in drug and alcohol. Or we hire more peers, and peers are great, but they're not clinicians. You know, and we talk about mental health and drug and alcohol, and we separate that conversation, but that's the same conversation. Mental health, we need mental health counselors to treat drug and alcohol. Like, drug and alcohol isn't peer, and then we have mental health licensed over here. It's one and the same, you know, and that encourages that. So that's something that, you know, that you're doing great on.
Secretary's done a great job on that. You know, we've tried to be really purposeful about driving dollars out to incentivize people to go into the jobs that we as a community need. So we've incentivized people in law enforcement. We're working on incentive for firefighters. For some reason, the legislature hasn't done that yet. We're going to get them to do it this year. We've done it with home health care aides. We've done it with teachers by creating a student teacher stipend, and now actually our number of teachers is growing for the first time in a number of years in Pennsylvania, and of course with counselors. So we're working really, really hard on this, and we welcome your ideas on how to make these dollars, you know, be even more impactful. Did you want to jump in, Joe?
Unless someone else has a comment.
I would just follow up on the retention in this field. Again, it's not just drug and alcohol field, mental health as well. You know, if you go around the schools locally, there's not a lot of people looking to get into the human services field, and I don't know if that's because people are seeing what's going on in the news and about funding not being secure. Maybe they were warned, don't go in that field. It's stressful, and you don't make what you could in doing certain fields. But I think I agree. My provider network would agree that we discuss this often, is keeping the talent we have. We have some great talent here in both Luzerne and Wyoming County, which I'm involved in. There's not a lot of quality talent banging down the door to get in. So we have a lot of gaps to fill, but we definitely want to retain the quality people that we have across the network. So,
are there things beyond the student loan repayment that would allow you to help people who are maybe a little further along in their careers? They don't have the student debt, but something where you thought, boy, if I had this tool, I'd really be able to hang on to these folks.
Reimbursement for providers. Like, I'm just going to throw that out there.
At the provider level, to allow providers to kind of incentivize maybe, it's at their discretion what they want to do as far as incentives for their staff. But, that's definitely a start.
And we will think about that. That's a great question, and funnel back to you and the Secretary's ideas that I know will come out of this discussion along that line. The thing I was going to mention, Governor, when you said, what can we at the state level do? What can you as Governor and Cabinet Secretaries? One of the frustrations, and I saw this at the federal level, working there, breaking down silos. We had to do that post 9/11 on the law enforcement intelligence side. I find at the county level, we're trying to work around, and it's nobody's fault. It's just the bureaucracy and the size of the state, and everything is defined by the legislature and the funding mechanisms. But this dichotomy and this distinction between treatment and mental health. you show me someone who is a substance use disorder sufferer that's not co-occurring, and I'll give you $1,000 for every one. And
60-70%.
exactly. And so if we can somehow break down those silos, you did it as chair at PCCD, which the governor mentioned, bringing together people from disparate places without those walls and impediments. So I think that alone, I'll give you a lunacy example of how we try to work around it. We have a co-responder who goes out with law enforcement to a truly mental health episode. Once everybody's safe, the police can go on and do their thing, and this person takes that warm handoff, this co-responder, and delivers that person to treatment. You know how we have to fund her? We take half of her salary out of the opioid settlement funds because it's treatment and prevention and education, and half of her salary from one of our providers who does the mental health side. So it's one person doing both jobs, and we have to bifurcate her salary every month with two halves of mental health and substance use disorder.
And that person works for the county? Is that who?
She actually works for me on
Okay.
the Letty side.
Okay.
She works for the provider on the mental health side. And then we now have her working in our prisons to try and help us with reentry.
I think that is a great flag you raised. We need to work through that. I'd love to make her our guinea pig. I don't know. That's right. That came out not the right way. Don't use that.
It was as bad as old friends.
Yeah. But no, it is important for us to kind of study how the commissioners and your office are sort of dealing with her funding on the back end, so we can figure out how to streamline that for you.
Yeah, absolutely. Thank you. But he's spot on, because even the programs that we fund, we're funding them through various funding streams and mechanisms. And with those things, with those funding types, there are lots of different administrative requirements. And so we're always thinking about how can we be more I'm getting a cue, like how can we be more efficient and reducing some of that administrative burden to get those dollars out the door so that our partners are true boots on the ground, that they have that ability to do that work in a more seamless fashion.
Good. Well, let's use this individual here in Wyoming County as the example of how to fix the system. I think that's a great thing you raised. Thank you.
Yeah.
Sure.
Yeah.
And she's a single mother who lives in an adjacent county, and she's almost there before the police arrive. That's the kind of dedication. Yeah.
That's wonderful.
Thank you.
I'd love to start with something that works. Something that's working really well is we don't have a shortage of Narcan to hand out. Though multiple events, we've given out everything we had with us in this county. So the community is receptive. So that's a win. We have the supplies. That's a win. The opioid settlement group has added onto the Wyoming County page where folks can request Narcan be mailed right to them. They can request Deterra packs be mailed right to them. That's a win. There's also a win to be able to give it out in the State Health Center, because that's a completely universal space. It has nothing to do with the courthouse or law enforcement. I'm just a nurse. So you're going to come talk to me. I'm going to tell you how to use it to prepare to save yourself or someone else. No questions asked. So we have enough Narcan in our county at the moment. I'm grateful for that funding. Another thing, though, being on all of these coalitions and all of these groups, a group that really pulls my heartstrings and is a downstream effect from this cause is grandparents raising grandchildren and our foster system. These are the folks, I hear stories about how they're refinancing their houses in retirement to be able to give kids shoes for back to school, and how the kids that they are taking care of and trying to keep safe have just the same needs and wants as any other kid in the county. So it would be great if we found a way to bring them forward bravely to let us know what their needs are, and also find an avenue to be able to fund some support for these grandparents that are trying to step in the gap and are already grieving possibly the loss of their child to the opioids. And now are helping children through this grief. So they're really, they're holding up a lot, and they're trying to stop, the generational effects of this. So they have a really big job to do. So if we can partner with them, that would be great.
I want to give Dr. Bogan a chance to just talk about the health centers. I know she was happy to hear you say that, but what is stopping the dollars from flowing to that grandparent? What is the bureaucratic sort of, not there that we need to undo?
Would you feel better prepared
You're
to answer
doing great,
that? So honestly, this is a silo issue. They don't feel safe to come forward. They are hurting. So we will say things like, "Hey, children and youth is really a helpful resource in our area," and they kind of cower back. So first of all, whenever we've tried to do something, the numbers don't come. Second of all, we're talking about tapped out grandparents that are trying to run these groups and then also need to be able to apply for funding or have the right, what is it called? Help me out. We just explained this this week. The avenue that they would need to be able to get grants. They need to establish
a 501c3.
Yes, thank
Yes.
you. That's what I'm talking about. So now you have somebody who is retired, possibly taking care of a parent, and running kids to activities in school and whatnot, and trying to be there for other people in their community and figure out how to establish these groups. So if there's an entity that can take them under their wing to support them so that they can get the funds to them. I mean, they've come asking for things from paper towels to toothpaste to you name it. Basic needs.
They are at a disadvantage at every turn. I had a gentleman the other day I was speaking, and he said, "I'm so glad you raised the issue of grandparents raising grandchildren because I am a great-grandfather, and I'm raising my great-grandchildren because I have lost to addiction and crime the 2 generations between me and my great-grandchildren. And their problems are they're not computer savvy, God bless them, I am barely. They're working still. We spoke with someone yesterday who took a loan on her house in retirement to hire a lawyer to prevent the father, who's got his own issues, from taking those children from her, and she is the only home and love that she has. Her perception, true or not, is that the word children and youth is mentioned, they're going to take away my children, which is a perception issue. And they don't feel like they are treated fairly when it comes to some of the agencies, that the fosters are taken care of, the kinship folks are taken care of. But we as grandparents, raising our own blood, out of our own love and heart, are not getting the support from the state.
Okay. I think that's a great flag. And look, maybe one of the do-outs from this on our to-do item is to figure out how to elevate this conversation and at least eliminate some stigma around it, and then figure out how to help where dollars are needed to drive those dollars out. So that's something we can partner on going forward. It's a good flag. Did you want to add anything, Dr.
I was
Reed?
just going to, first of all, thanks for Amanda. It's amazing in our state health centers, which are in 59 counties. And so we have Narcan available, naloxone available in all of our state health centers for those in other communities. But this conversation about grandparents raising children is not unique to this community, right? It is across the entire state. I certainly saw it as a pediatrician frequently. And so, and the resources are very limited. And not all the people who have, there are legal challenges to their own getting the paperwork they need to be legal guardians. I mean, which is an expense. If they haven't gone through children, youth, and family, where that's taken care of, then it's at their own expense to develop kind of that legal relationship. So there are some challenges beyond that families face, but I agree it is an ongoing challenge here and elsewhere. So I appreciate that you raise it.
I hate to put the school district on the spot, but these kids need to go to school. Their grandparents are getting them there. Somehow teachers are engaging with the grandparents on the kids' education. Are there lessons we can learn from the school district that can help us in this space?
Thank you for the opportunity.
Sure.
What's become very prevalent is a lot of at-risk kids that we see. It turns out they're being raised by grandparents or grandparents. When you dig in, you see that there's substance abuse problems. You see that someone's incarcerated or has passed. And, in a community, footprint that our district is 297 square miles. But where does everyone come? Everyone comes to the school. Every event is held at the school. So in a lot of ways, we become the front line in identifying who's really in. And I'm very proud of our partnership with CAMI. You know, we pay for CAMI, our portion of CAMI salary out of Title IV federal money. With our PCCD, we actually took our PCCD money, and I think you'll be very proud of this, we hired a trauma counselor.
That's great.
Never have before. Because what we realized is, in addition to our school counselors and our social workers, that when a student goes into crisis, and it happens for various reasons, almost daily, when that student gets sent somewhere and is dealt with the crisis, when they come back, you can't expect everything to just be right. Normal. So now we have
Correct.
a full-time in-house licensed, trauma counselor that we're utilizing that money for. And thank you very much for that, because that's been a huge help. But when you get in our faculty is real good at getting to know our students, it becomes real obvious who needs help. And we work very closely with our agency partners, trying to help to as many people as possible.
Okay. Thank you.
Yeah, I would say that. I would say that too. That they're very quick to refer to the right place, and if they don't know, our school counselors are amazing. But those kids are identified early. I have in touch with our primary school counselor almost daily. She finds out there's a grandparent involved. They lost somebody to overdose, so I'll jump in or I'll get our trauma counselor or another counselor involved. So they do a great job of identifying those kids.
Can you talk a little bit about the student assistance programming that's happening? So are the staff members that are involved in those programs, are they duly trained in sort of drug and alcohol and mental health?
So I'm actually a trainer for the state. I am a SAP trainer, so I train the new teams. They did just revamp and kind of took out the pieces that were drug and alcohol and mental health specific, but we do touch on that in our training. So yes, the people that sit on SAP trainings throughout the state of Pennsylvania are trained in both mental health and drug and alcohol. The purpose of that is to have the teachers, though, really identify those kids in need, and then they come to us, and then we, through the process, funnel them to the correct place. I will say Tunkhannock High School is another, thing that I would tout does an amazing job. They have an amazing SAP team that I sit on. But yeah, that is something that both of those contents are covered.
Yeah, I was just thinking about that from the perspective of grandparents, another way to identify where the supports may be needed.
Yes. Thank you.
I hear you on the grandparent issue. What other issues should we be thinking about? What were the things you were thinking about on your way over here? Saying, I got to tell the governor that. Good.
I just want to point out again the importance of knocking down the silos and the whole community approach. I think here in Wyoming County, that's what we have most at our benefit, is that whole community approach. All of us sitting around the table do naloxone, education. If you have a group that comes to you that needs education and you can't do it, we know who to contact. We really, broke down the silos within the county to make sure that we could focus on the important things. And from an EMS perspective, that is even more important when we think about the numbers and the decrease in numbers. Here in Wyoming County, we no longer have a hospital, so breaking down or cutting down the numbers of overdoses, that is reducing the number of EMS responses and allowing the ambulances to stay in service for other emergencies as well. And we all know that, EMS is in somewhat of a crisis as well, with recruiting people, the reimbursement scheme or the reimbursement process is difficult. So I think that downriver, we're seeing those benefits for our EMS system as well by all that we're doing as a community, whole community approach to reduce the number of overdoses here in Wyoming County.
And Governor, I have to echo that. He stole my thunder, because tomorrow, Bob and I and our media partners, who, by the way, are terrific. The media in this county is not an impediment. They are a partner that includes public media as well, public TV and National Public Radio. And we are, one of the ancillary impacts negatively in a county like ours that you don't see in Montgomery County or Allegheny County is the fact that we have a dying EMS service. We have ambulance companies that are closing. We do not have a hospital in this entire county. So we want to talk about that output unintended on our EMS services. So we're going to use our opioid settlement money, thank you very much, as AG, and we are going to try and reimburse our ambulance services to keep them limping along for the cost of the call whenever they resuscitate somebody, and then use that as the driver to help them recruit and retain volunteers, because you have a heart for firefighters. You mentioned it earlier here today. You're trying to work with the legislature. There are few paid EMS responders. We as police get taken care of. We as firefighters in larger areas get taken care of. In this county, almost everyone, firefighter and EMS ambulance, is volunteer.
Yeah.
And just to tack onto that, we have, farmers coming off the farm going on EMS calls, and a call that used to be a half hour to an hour long is now 3 to 4 hours because we're transporting significantly longer to get to a healthcare center. So it's a pretty big impact for our first responder community and our EMS system here in Wyoming County and across the region, really.
I think it's smart that you want to use and I don't want to weigh in on how you all decide to use it, but I would just say I think the concept is smart, and I think it makes a lot of sense, particularly given the challenges. Yeah, great. What else? Actually, I want to ask you a question. Do you prefer Bob or Robert?
Bob.
You're now. Multiple people have talked about how well this county works. Joe began his comments saying that you've got all 3 county commissioners here. You got mayor, you got people of all parties here. Why does it work well? I mean, what can we learn from Wyoming County that we can take with us to other counties, maybe where it's not working as well? What's the secret sauce?
I think the big piece is, we're able to network and get to know each other and know what resources are available. I mean, there's a ton of resources, and many people don't know that. So coming to the table and working together through problems, it's not just one perspective looking at what that problem is, but it's multiple different perspectives. I mean, somebody might ask, why is the EMS guy on the panel for the opioid epidemic? Well, it's an important piece, and when I was working full time as a paramedic, I didn't always know where to push those resources. And in my position now, I'm kind of able to get to know all those resources, and I always focus from a regional standpoint on educational opportunities that aren't like the sexy topics, but the things that are really important. And from a regional perspective, I'm able to get that information from this whole community approach and from all the contacts that I make, and able to push education out there on these things that aren't necessarily taught in an EMS curriculum. Okay. We don't talk about so much soft skills, and how to be compassionate, and they're really the most important things. So focusing on that stuff across the region, across Wyoming County, is important. I will say that having our commissioners extremely involved, our DA, all of these working pieces are so important, even when we're trying to fix the EMS problems across the county, across the region. I have other counties that I oversee as well, that things don't work quite as seamlessly. And we're trying to work towards that, but it takes a little bit of time. But it takes all those different important pieces in order to put the puzzle together, in order to fix the problems, and not just EMS problems, not just opioid problems, but all of our problems within a specific area.
And we have the ability, Governor, and when I was introducing those in the room, and I did it off of Drew's card, so if I missed anyone, but those that aren't here, we can call our Congressman, Muser, and Mike Maribel, his representative, is here. I got a call this morning from Lisa Baker. Please tell the governor I would have been there, except I have this commitment. I got a call from Representative Tina Pickett. Basically the same thing. I would have loved to have been there. And it's that kind of working relationship, not only here, but that you have sort of transitioned to Harrisburg and government. So
And by the way, Lisa and Tina are wonderful. We work with them on a number of things, and Lisa actually chairs the committee where a lot of these dollars go out. So you're blessed to have her in your community. Anybody else want to?
Well, I did.
Good.
I said I wasn't talking about.
Yeah, good, Cammie.
Here I go. Well, about this community, though, I want to go back to that. The other thing is everybody's approachable. So I truly, I have DAP, I'm the drug and alcohol prevention person in the district. I have the DA's cell phone number, and I'm texting him things. I called Bob and said, if the roads are bad tomorrow, I'm going to need you to pick me up. And the commissioners are the same. I know the commissioners are the same way. Everybody's approachable. It's not one of those they're here. And
Yeah.
So we could just go to each other and get stuff done. And I think that's what really is the secret sauce here.
That's great.
The egos. There's not a lot of ego. It's all about
Get stuff done. That's important. I heard you say that. I'll pick on your commissioners. By the way, we'll see how well they really get along.
Okay.
One of you, not all three of you, you decide which one. Give me your thoughts on this, because I think it really speaks to your collective leadership.
Well, I'm the minority commissioner.
Okay.
Attorney King, and
yeah.
I'm not treated as a minority commissioner, okay? And the main thing is that I was elected by the voters to do the voters' job. Yes, it's great to have the party behind you, but that's not who elected me. The voters do.
Yeah.
And I'm very, very adamant about working with these guys, and I have no problem working with these guys. So we work together. We talk together. We sit together for an hour plus a day to talk about issues that will affect our voters in Wyoming County,
Yeah.
not just one party or the other.
I can't believe you spent an hour talking about issues. You got to talk about something else. Come on. No, I was a county commissioner in a previous life, and I was very proud of the fact that over the course of 4 years of the three of us working together, I think we had 2 negative votes the whole time. We found ways to come together. I think the county commissioners are sort of right. That's where the rubber meets the road on those things. So glad you guys are working together.
Can I just say one more thing?
Yeah.
This community has the biggest heart I've ever seen. We do all work together. If we need something, we can pull from any one of all of you guys. Over the years, we've had issues with drug and alcohol, and or people understanding the lock zone and basically just prolonging the diseases.
Stigma.
And doing all that. I just want to say that I've never worked with such a group of people that volunteer and work together to make sure that everything's right. I'll be working with Endless Mountains this afternoon. I have somebody in the jail that I work with constantly that needs a place to go. They need a safe place, and they're not safe anywhere else. We're going to put them in treatment. They'll work with me to do that.
Good.
Keep Cammie for years. I have been sober for 39 years, and it's helped people.
That's awesome.
If you need help in Wyoming County and you don't get it, there's something wrong.
Yeah.
So it really is a wonderful group of folks that we work with. And Governor, you're here in our county helping us promote this, and I'm very grateful for that. And we've done wonders with our opioid settlement money and the things that just if we need help, we all work together. All the treatment facilities, everyone works good. I couldn't be proud.
That's great.
Yeah.
I'll share with you.
We do have only 5 more minutes left, so
Okay.
that we can get final thoughts from everyone.
Sure.
before we wrap that up.
I'll just share a quick story on the opioid settlement. We negotiated this in Cleveland, of all places, and there were 4 attorneys general from around the country who were the leads: myself, the AG of North Carolina, the AG of Tennessee, and the AG of Texas. 2 Democrats, 2 Republicans. We were all totally aligned on this. I remember when we walked in the courtroom the first time in Cleveland for discussions, the opioid companies offered us $1 billion for the entire country. And Joe knows this. In court, you're supposed to conduct yourself with some decorum. My decorum level went way down when they made that offer. In the end, of course, Pennsylvania's share was $2 billion. They wanted to spread $1 billion out across the whole country. So we fought hard for that. One of the other things we were super purposeful about, and I don't want to lose sight of this, and these were 4 state actors, remember, and we were committed to making sure that the lion's share of the money went to our counties. I mean, that we knew that you all were where the rubber meets the road. You could get your act together in a way that statewide policy couldn't be a one-size-fits-all. It had to be tailored for the local community. And so to sit here and see that the dollars are really making a huge difference, that you've been able to put together a local plan that is actually helping save lives, is really exciting to us who sort of fought in these courtroom proceedings to get it done. So I appreciate you sharing that with me, the way in which these dollars are really working. So, all right, Drew, for some reason we listen to Drew, and he's telling us we have 5 minutes left. Let's just sort of zip around. Tell us, some final thoughts here. Go ahead, Michael.
I was going to say, between the opioid funds and the funding through the overdose prevention program, it's been a game changer. We've been able to do things that would have been possible. Anybody, in Luzerne or Wyoming County, citizen, provider, anyone, fire department, doctors, anyone can reach out to my office. We give them Narcan at no cost. So that, since it's become available, I believe it's about 2 years now. Mm-hmm. Yeah, it's just a game changer. We used to have to purchase it out of our own allocations, and we're talking tens of thousands of dollars, probably every 6 months. So we've allowed to, we can put that money towards treatment, especially life-saving treatment like detox for someone that needs it. So just want to say thank you, and we are grateful in Luzerne, Wyoming counties.
That's great.
Drug and alcohol program.
Some of the data we have, and you may know this better than I, that we've been able to distribute from the state side 35,000 doses of naloxone in northeastern Pennsylvania, and believe we've saved about 233 lives. The we is not we, the Commonwealth. The we is all of you. So, I mean, that is real when you think about it. What's that, Madam
Yeah,
Secretary?
the spokes and hub.
Yeah, absolutely.
So my take back from everything is professionally, I think we're doing good at the county. The only thing I would want to do better is stigma on the individual with substance use disorder, the individuals with mental health, the grandparents. Like when we talked about it, the running theme is stigma and has been the conversation for 15 years. But it's difficult for people to come to these discussions because of the media, because of the press, because of the stigma that we have on this.
Yeah, I think you're right. Look, we've been saying this. The fact that you got your chief law enforcement officer of the county here acknowledging that we all think drug addiction is a disease, not a crime, that's a big deal.
Big deal.
That is a big deal, and that is not the mindset everywhere, and that certainly wasn't the mindset 10 years ago. And I think that speaks volumes about the way in which this county is operating, and I think it speaks to the progress that we've been making, the lives that we've saved.
Yeah.
So I agree with you. We got to keep at it, and if there are ways that my voice and the secretary's voices can help, and I'll volunteer your DA's voice.
Actually, about to give
let
a
us
whole
know.
plug. We do have an anti-stigma campaign for Pennsylvania. It's called the Life Unites Us campaign, and it is so focused on removing the stigma associated with having a substance use disorder. So we'll make sure that everyone gets that information. It's a powerful resource. So please, Life Unites Us. I think it's .org or .com. LifeUnitesUs.com.
And how does it work? What does it accomplish?
Oh, actually, we have a series of influencers across the Commonwealth that actually share their stories, their recovery stories, sharing the hope and power of recovery. My team is saying something.
Go ahead.
They want me to talk in the mic. They're like, please use the mic. And so it's a collaboration with Penn State University, Public Goods Project, and Shatterproof. And it really is centered around using social media and social influencers to spread the word and to reduce stigma.
And free to the good folks here. in
Yes,
Wyoming
it's
County.
free.
Okay. Oh, you got it?
You got it.
And I'll say the counterpart is that, as a healthcare provider for many years, stigma's alive and well in healthcare, and we really need to address that. So one of the things the Department of Health has done is put out educational modules that are available through Train PA, specifically around stigma in healthcare and how to reduce that. So education around maternal health and pregnancy, stigma, and care. So we cover kind of the education of more healthcare providers, and DDAP really focuses on education around drug and alcohol providers' education, so the work is divided. But stigma is a part of that education. It's a huge part because if people won't come in your door, you can't help them.
And Doc, where can folks access those resources?
So Train PA, which is the website that has that, and it's the continuing education website where our EMS workers get their training, and where we provide it for healthcare providers, nurses, doctors.
Great.
Yeah.
Great. Amanda?
So I would just end by asking us all to not let our foot off the gas. As our numbers improve, can we just stay this focused? Stigma, for sure, needs to be something that we break down silos. But in anything, if we take our focus off of it because we feel like we're doing better, as Dr. Bogan and I were talking earlier, issues re-arise, and this is one I don't want to see re-arise. So thank you for everything that you've done to help us get our numbers down, and thank you for coming today.
You're welcome. You're welcome. And as I said at the top, we should celebrate our collective work, and what we're doing is working, but we can't let up until that number that was 15 is now 6 is 0. That is our goal, and we got to keep working at it. So I appreciate you saying that. Bob?
So I'm grateful to hear the numbers, the decrease in the numbers, and as we push forward, I just ask that we look to be more innovative in different areas, and we have been very innovative. So EMS does leave behind Narcan. Sadly, not all EMS agencies do that. So pushes like that. How do we get even more people involved in this movement, and so that we could be even more successful? And next time when you come see us in Wyoming County, we have the numbers at 0.
Good. When they don't leave it behind, why?
I think we go back to Dr. Bogan's stigma. I really think it's stigma.
We had a conversation with the regional council directors about this a couple of months ago, actually, specifically about how do we get all of the EMS agencies to do it. So we do have funding for education around naloxone and response to opioids that we're working with the EMS agencies on. But again, it is a conversation we're having with all the regional council directors, because we ask that exact question: what is keeping people from doing it all the time?
Okay. Well, that'll be another do out here that we've got to follow up on, and maybe, Bob, you'll talk to one of those people with a camera and look in the camera and explain why you leave it behind, and we can share that around the Commonwealth as a way to correct that behavior. So thank you.
Thank you.
And I was just going to
Tammy,
echo Bob.
you really need to come out of your shell.
I know.
and tell us what you think.
I'm working on it.
Yeah, you went to the Drew Popish School.
I did. I just echo Bob. I know, like, in doing trainings, it isn't just about like how to do it. That's a 5-minute training. Let's remind people this is somebody's someone. So this is somebody's mom, dad, brother, sister that you could save a life, and it's the easiest way to save a life. So, and the other thing, what I was going to say before Bob, I thought, oh yeah, that's important. Thank you for coming, and thank you guys for making this important. And
Yes.
so you have no idea how we appreciate it.
Absolutely.
We appreciate it.
Joe?
Best place on earth.
Thank you, Governor. I'll just conclude by saying 2 things, if I may, please.
Sure.
All the things we talk about, all the innovation that you lead, that we try and implement and maybe even improve upon, works. You heard from a county commissioner who admits, no stigma, proud, let me help others. I'm in recovery for 20 plus years.
That's right.
I just left my office, and next door to me is an ADA who was arrested by the Office of Attorney General and in state prison until she, with the help of drug treatment court, put herself through college, through law school. She's now a single mom who is my ADA. She is an evangelist for treatment court and second chances, and she is a tenacious prosecutor of those who deal drugs and who would affect children. And as to the 800,000 or so doses of naloxone, and thank you, Madam Secretary and Governor, 2 of those, one weekend ago, I got a call about 10 o'clock at night from a local fire chief. Got to stop giving that number out. And
Tammy gives it out.
he said, do you have any more Narcan? I have 1 left, and my folks just saved 2 lives. Can I get some on Monday? I said, no, I'm coming to the firehouse now, and you'll have it tonight. But without that education, without you providing it for us to give to them, those 2 lives 2 weekends ago would not have been saved. So the proof is in the pudding. Finally, there are 67 counties, any one of which you could have gone to today, to talk about success. It's not always easy, and you don't have many successes as a governor to talk about. But you chose to come here. Well, I know he's getting blank done, but he still has to deal with Drew. But you chose to come here to talk about our innovation, and it's really a credit to everybody in this room and you, so thank you for coming.
Thanks. I appreciate it. Let me let the secretaries offer some final words.
No, Drew's gonna kill us for 5 minutes. But no, I will just say, Governor, under your leadership, we are making progress because you are allowing us to invest in proven life-saving strategies. A part of this work, each and every day, we're trying to ensure that all Pennsylvanians in all zip codes have access to prevention, treatment, recovery support services, along with overdose prevention supplies. So thank you for giving us that ability to do this work each and every day. And I just want to say thank you for everyone in this room and you, Governor, for recognizing that a substance use disorder is a chronic relapsing disease. It's a medical condition. It's not a crime. It's not a moral failing. And the fact that we're all here today, pulling our resources together to make this work happen, I'm so extremely proud. So thank you, Governor.
Thank you.
I'm just going to agree with Dr. Davis-Jones, but also I think the other part of the administration that I think is really unusual is how well we work together across agencies. And that was a message I got when I took this job. I remember you telling me that you expect all of us to work together, that it was your expectation. And I think part of the success of the administration really is that has been the expectation. And, we work with Dr. Davis-Jones and with our Human Services Secretary and Insurance. It really is a multi-agency response. You can't, as you all know, you can't all do it by yourself, right? It's everybody working together, and that's true at the state government too. So thank you. And I also will tell you that the farm show, which I know you all is going on right now,
awesome.
We have a table for the Department of Health, and the naloxone is flying off the table. We have given away hundreds and hundreds of doses at the farm show.
That's great.
So that you'd like to know that, along with the cute pets.
I'll just close with this. Thanks for welcoming me back. Thank you for the incredible progress that you're all making. And thanks for giving me an opportunity to see some light in the midst of a lot of darkness and challenges in our communities and in our politics today. I don't mean to be political, but I think we can all agree that there's just too much division and there's too much challenge. My wife Lori and I try every day to take a walk together. And sometimes it's really early in the morning and sometimes it's 11 o'clock at night. The troopers hate when we do that. But part of what we do on every walk is talk about the kids, talk about us, and then we talk about our days. And one of the common themes when we talk about our days are, hey, I was here. By the way, when she was in your school district, I heard all about it. But I was here and I saw these people doing amazing things. And it has a way of just filling up your cup and driving you to have more purpose in your work and being excited to get up the next day and start all over and continue to push hard. And so I just want to thank you for the inspiring work you're doing. There are 67 counties. We chose to be here in Wyoming County today because A, we know we got a lot more work to do, but B, there's a lot we can learn and be inspired from in the way in which you all are doing your work. So thank you for giving me the privilege of getting my cup filled up by all of you. Thanks for giving me something to talk about on my walk late tonight with Lori when I finally see her, and just continued success in the work you're doing. We have a number of do-outs on what we need to do. I want to give some more thought to the prevention counselors issue and how we might be able to uniquely fund that in our schools, separate and apart from the mental health counselors. I understand the importance of addressing the grandparent piece, and some of that's going to be education. Some of it may be dollars, or at least getting the dollars we already have flowing to them. So we're going to have to work on that. Glad you have enough Narcan, but we're going to stay on that and make sure that that supply continues. I think the stigma pieces are going to be important for us to continue to address, the EMS pieces as well. And again, your DA is an expert on this, how to access the dollars at PCCD to drive back here. We will continue to make sure that those dollars make their way to Wyoming County, and you'll let us know what you need here. But again, just thanks for giving me the privilege to come back to your community, to learn from you, to be inspired by your work, and to now hold this up as an example to the rest of the Commonwealth of how we can continue to make progress. Again, going from 15 lives of our neighbors lost every single day to 6, and now hopefully going to make even more progress from there. That's something we should celebrate, but it's also got to drive us to keep going, keep pushing, and I certainly will as your governor. So thank you all for having us. We appreciate you. Thanks. All right.
So there was a shakeup at the federal level last night with funding for mental health and, addiction services. Has that impacted Pennsylvania? What are you hearing? Is there next steps to that, or does it seem like everything's okay?
Continue to stand up to ensure that dollars, whether they go to helping people with addiction or making sure that our air is clean to breathe and everything in between, that those dollars make their way to Pennsylvania. We do have an update on this particular line item, so I'll ask Dr. Bogan to share some thoughts.
Thank you.
Thank you so much. So we did receive initially a notice that we had lost 2 of our grants, but I'm happy to say that this morning we received a note saying they had been restored. So I know that's been reported across the country as well. So Pennsylvania has received back the funding.
Sure. Thank
Great.
you.
Yep, thanks.
All right, now I have an off-topic.
Okay, go ahead.
Okay, so I have been covering since July many public meetings about data centers. And a lot of residents are concerned about these developments specifically close to their homes, close to their schools, and they feel somewhat let down at the state level. And I'm just wondering if you can respond to kind of their concerns and, do you feel that there is an appropriate place for data centers in Pennsylvania, specifically Northeast Pennsylvania?
I think it's critically important that local voices be heard in this process. And whether it's a data center or some other business, it needs to be sited in a place where it can spur on economic growth and economic opportunity for a community while not negatively impacting neighbors or negatively impacting our environment or our air quality or water quality. And I think it's really important to strike a balance on all of those things for data centers or other developments. I think what's important is what's happening here in northeastern Pennsylvania, really across different parts of our Commonwealth, where neighbors are being afforded the opportunity to be heard from, typically at a township or a county meeting. Those voices are then integrated into determining what the plan should be or whether the plan should not go forward. And I think the more local voices are heard, the better for this process.
Do you think there's guardrails that the state government could kind of put on these developments? A lot of times you have lawyers coming to these meetings without a tenant at the table, without kind of, real detailed plans about what these could be, but yet they want them to be maybe 500 yards from a school.
I think it's a really thoughtful question, and one that I want to follow up with you more on for the following reason. We are getting ready to announce numerous standards at the state level that we hope local communities will be able to use as a guide to evaluate whether a project is in keeping with the needs of a community and the Commonwealth, or whether it runs counter to. We hope that would not be a directive to local governments, but rather a guide to local governments as they go forward and assess whether or not a project should occur in their communities. So stay tuned on that. We should have more to say about it over the course of the next couple of weeks.
Thank you.
Thank you. And I would say that as we're working through this process, we're hearing from local voices who are informing our process.
Thanks.
Thank you.
Hi, Governor Shapiro. So we are seeing ICE enforcement across the country making headlines. even, leaders across cities here in Pennsylvania speaking out regarding ICE enforcement. About a week ago, we reported on some rumblings we were hearing regarding an ICE facility potentially being built, the fifth one here in the Commonwealth, in Lower Schuylkill County.
Yeah.
Just your thoughts on the enforcement ramping up across the country and the potential of that center coming right here north.
Well, first, I hope the federal government does not put that center here in northeastern Pennsylvania, period. Second, I will tell you, and I know that the DA understands, the way you create a safe community is by building trust between law enforcement and the community. I have immense respect for law enforcement. I made a commitment when I got elected as governor that we would hire 2,000 more police officers, both state police and supporting the hiring of municipal police across Pennsylvania. I think we're up to around 1,900 at this point. We'll eclipse that 2,000 number. At the same time, and you heard us talk about some of this here today, we also have invested hundreds of millions of dollars in violence prevention initiatives and other supports for the community. What that accomplishes is recognizing that to deal with safety issues in your community is in part law enforcement and in part community supports. And we've brought those two sides together. Why have we brought them together? Because we create trust in a community, and with trust comes safer communities. What you are seeing with ICE showing up, for example, in Minnesota, not at the invitation of the governor, not at the invitation of the local mayor or local jurisdictional leaders, is an action that eviscerates the kind of trust that is needed in a community. And I think it is really important that here in Pennsylvania, that we preserve and protect that relationship between law enforcement and a local community, and that trust that we have all worked so hard to build. You heard before folks talking about how they've got the DA's phone number. And I'm sure if the police chief were here, they'd say the same thing about the local police. That is the way you strengthen trust. What the president is doing, what others are doing, Secretary Noem is doing, I think is undermining the trust in communities. And we're going to continue to work hard to bolster that trust here in Pennsylvania and try and stop ICE from coming in and undermining that in our Commonwealth.
Thanks, guys.
Okay? Thanks, everybody.
Thank you.